But first, let's head to the Fox 11 Fieldhouse. The following segment is sponsored by Aurora BayCare. Abby Destry was out there to get some tips on staying healthy.
Hi, joining me today is Dr. Scharer, a foot and ankle surgeon at Aurora BayCare Medical Center. Good morning, doctor.
Morning.
Well, today we're talking about ankle arthritis and some treatment options. First off, what is ankle arthritis?
So ankle arthritis is the loss of cartilage in the ankle joint. Typically, that's a result of some previous trauma or injury. It can also be a result of an inflammatory disease like rheumatoid arthritis as well. Most common symptoms early on, usually pain and swelling, difficulty walking. You know, if you're on a long walk, you're gonna have a lot of swelling and achiness towards the end of the day.
When would ankle reconstruction be an option?
So complex ankle reconstruction is reserved for patients with severe arthritis. Many times those patients have failed injection therapy, bracing, anti-inflammatories, physical therapy. The most common procedure we use for severe ankle arthritis is ankle replacement. That's where we'll actually remove the arthritic ankle and then replace it with synthetic components to get a normal motion in the joint. Obviously, the goal of this is to reduce their pain, increase their function, improve their quality of life.
What does the recovery look like for that?
So typically it's about 4 weeks limited weight bearing and then another 4 weeks in a boot. And then after that, typically we get them back to their shoe and then another 4 weeks of physical therapy.
Thanks, doctor, for the information.
You're welcome.
If you would like more information, you can visit aurorabaycare.com or be sure to download the LiveWell app. You're watching Good Day Wisconsin, and we will be right back.